This is a demonstration video of Gordon's functional role relationship patterns. This video is strictly for learning purposes and all the content is fictional. We will be assessing a 22-year-old female who has been experiencing fatigue, headaches, no appetite, and weight loss.
Hi, Ms. Johnson. My name is Gianna. It's nice to meet you, and I will be your nurse today. Today I'll be asking you a series of questions. If at any time you feel uncomfortable, just let me know, and we'll just move on with the rest of the appointment. Can you please state your name and date of birth and why you're here this morning?
You can call me Charlie. My date of birth is January 12th, 1993, and I'm here to complete a health interview.
Okay, Charlie. We do this to ensure that we have the correct patient. Also, everything you tell me today will be confidential and will only be shared with other health professionals if needed.
Thank you.
So to start off, how about you tell me how you're feeling today?
I have been having a lot of trouble sleeping lately, and I seem to be getting a lot of headaches.
Where do you typically feel pain? Is it more of a dull pain, sharp pain, or does it feel throbbing?
It's more of a sharp pain behind my eyes.
Have you been taking any prescription medications or over-the-counter medications to help with the pain?
I've been occasionally taking Advil for the headaches.
How do you typically feel after the medication?
I tend to feel a little better, but it feels like it always comes back.
Do your headaches appear to happen on days when you do not get enough sleep?
Yeah, I think I do tend to get more headaches when I don't sleep, but I don't get enough sleep normally because of school and work.
What school do you go to, Charlie?
I'm in the biochem program at Marquette, but I want to go into pharmacy afterwards.
That sounds intense. I'm sure that there's a lot of stress to deal with. Can you rate your stress level for me on a scale from 1 to 10?
I'd say about a 7.
From what you are saying, I would say you feel pretty stressed at this point in your life.
Yeah, I would say that.
Have you had any other problems that might have to do with your stress levels, such as hair loss?
Yeah, I have actually been losing some hair. My drain is full of hair after I shower, and there seems to be a lot more in my brush.
Do you do anything to relieve your stress? Like, are you in any sports or a part of any campus groups?
I meet with a couple study groups on campus, and I'm on the tennis team, so that helps.
Are you close with any of your team members?
I just joined this year, and it's hard to fit in because most of the girls have been playing together for 2 years now.
How close are you with your coach? Hold on, I just need to check this. Okay, you were saying?
My coach has taught me many things on and off the court. She's very tough on me and our team, but I feel like I could talk to her about anything.
That's good. You have someone that you feel comfortable talking to. How do you feel when you're at practice?
Physically, I've been feeling very fatigued lately.
Well, that's not good. Tell me about your diet.
I do my best to eat healthy.
When you say you try to eat healthy, what does your average meal look like?
I normally have a bowl of oatmeal for breakfast, a ham sandwich probably for lunch, and dinner I usually get a large salad.
Good. It's important to eat well and stay hydrated. How much water do you think you normally drink?
Not as much recently since I haven't really felt thirsty or had an appetite. But are we almost finished?
No, we still have a few more questions we have to go through.
Okay.
Why do you feel like you lost your appetite? Do you usually eat your meals on campus?
I normally eat on campus with a group of friends like every day, but we haven't really been going lately.
Why did you and your friends stop going?
Well, my best friend and my roommate committed suicide about a month ago, and it really affected my friend group. We just don't want to go out and do things anymore, so I feel pretty alone most of the time.
How did you meet your roommate?
My freshman year, I joined chemistry club, and I met her through that, and I found out she lived on my floor.
What made you join the club your first year?
I wanted to get involved and meet new people.
Are you still a part of the chemistry club?
No, I stopped going a long time ago because I lost interest.
Did you meet all your friends through this chemistry club?
We all met because we lived on the same floor freshman year. We all kind of connected the first couple of months of school.
Do you feel like you can talk to your friends about the loss? Like, why don't you all grieve together?
After she passed, it made me realize that she played a big role in keeping our friend group together.
You mentioned earlier that you are close with your coach. Have you talked to her about your loss?
Yes, I did. She let me miss practice for about 2 weeks. I go and talk to her about every couple days.
How has the loss affected your classes?
I was going, but then I stopped for about a week. It put me really far behind, so I just stopped going completely.
Do you have any professors that you feel comfortable talking to? Maybe they could help you.
There's one professor that I'm considering going and talking to about this, since she's helped me with chemistry in the past, and I feel like she'll understand why I'm falling behind and maybe even help catch me up.
After you talk to the professor, maybe you should stop by some of your other professors' office hours to see if they can help.
I'll consider that.
So how about a significant other?
I had a thing with this guy about a month ago, but it didn't really work out.
Do you have any family members nearby?
No. I'm from California, so that's where all my family still lives.
Do you talk to your parents often?
We occasionally Skype, and I call my mom on the phone, but I'm busy, and so are my parents. It's hard to find time.
Sorry, this is just really important. Okay. Are you able to go home on breaks?
Yeah. Every break, my parents fly me home, which is nice.
Do you ever get homesick?
I did when I first moved to school, but then I got involved and didn't as much.
How about now?
I would love to be done with school and move home. My mom knows how to comfort me. I miss my family very much. They're really important to me.
How many siblings do you have?
I have 2 older brothers and a younger sister.
Tell me more about them. Are you close?
Yeah, we're all very close. I can tell them anything, really.
Talk to me about your friends back home.
I had a very close friend group during high school, but some of us moved far away for college, so we kind of lost touch.
Do you have any social connections outside of family and friends, like church? If this makes you feel uncomfortable, we can move on.
No, I'm fine. I do go to a local church here, but I wouldn't consider it a way for me to be social. I'm not a part of any Bible study groups or anything like that.
You mentioned earlier that you also have a job. Where do you work?
I've been working at a small coffee shop for the past year.
Do you have any coworkers that you are close with?
I have met up with this one girl a few times.
How do you feel after you talk with her?
I do feel much better. We're actually meeting tomorrow.
That's good. How are the rest of your coworkers?
They're very good, actually. I feel like they're a second family to me.
What do you mean by a second family?
They're just the people that I can go to with all my problems, and they help me out a lot since I don't have any family around here.
I love that you feel like you have a good support system in the area. So where do you see yourself in 5 years?
I hope to be finished with school and maybe
Okay.
have a husband.
Okay. How about your professional career?
My dream is to be working in a small pharmacy.
Wonderful. So did you take anything from this appointment?
Well, I'm starting to realize I should get involved more and create more friendships and close bonds with people.
That's very good that you can see that you should expand your social horizons and so you don't feel so alone. I'll pass this on to the doctor and see how he would like to proceed. I have this pamphlet on how to deal with stress that might be helpful to you.
Thank you.
Thank you for your time today, Charlie. I hope things start looking up. Have a great day.
Thanks.